Hello, my name is David Anderson, and I'm glad you joined me. I'm going to discuss a topic that is meaningful to everybody, and I would imagine it probably floods all of your social media feeds, and I'm sure you commonly banter it about at all your dinner parties, barbecues, whatnot, and that is degenerative disc disease. It's not? I can hear you thinking, great, I didn't realize I was going to be attending a speech that's geared toward the American Medical Association. It's not, I promise. I assure you, this isn't that kind of discussion. I am sharing my personal experience with you about degenerative disc disease to help persuade all of you to consider a disc replacement as opposed to the common practice of a spinal fusion should medical intervention be required if for your disc degeneration. Because, spoiler alert, it's inevitable. My degeneration revealed itself in my neck or the cervical spine when I suffered a injury at work. And from here on in, I'll basically refer to the cervical approach to spinal fusion just because that's my direct reference. In the attempt to address my situation, I underwent the common practice of a spinal fusion. The reason I am having this discussion is to encourage each of you to consider the disc replacement as an alternative to a fusion should your degeneration become necessary. The reason being that I am encouraging you to do this is three factors mainly. First, the success rate for a fusion is much higher, or a replacement, excuse me, is much higher than for a fusion. Also, post-surgery recovery time is a lot shorter for a replacement, which allows you to get back to your normal activities a lot sooner. And finally, and I think what is most important, is the mobility that is maintained with a replacement as opposed to a fusion. Now, first, let me clarify what degenerative disc disease is. It's not really a disease. It's actually more of a condition or an affliction. It's kind of like an arthritis, if you will, and it can be caused by a variety of different things. Most prevalently is just aging over time. Doesn't matter what it is. Excuse me. According to numerous publications cited by the National Library of Medicine, by the age of 35, approximately 30% of all people will show signs of degeneration in one level or more, and the levels are the areas between the vertebrae where the discs set. By the age of 60, more than 90% of people will show evidence of degeneration. Other things include daily activities, general wear and tear, sports and injuries, because that adds extra stress to the body, which then can cause the degeneration of the discs. Other factors include genetics, uh, weight, excessive weight, and smoking. My case resulted from a combination of a few things: aging, general wear and tear from decades as a tradesman and a martial artist, early stress on my neck as a youth playing international soccer at a highly competitive level, and I'm a smoker. What happens is the signals start to give you pain triggers, and they will come from a couple of different factors. The degeneration of the discs, which is basically a leaking of protein out of the discs, and makes them collapse, which then causes inflammation and swelling. The inflammation then creates nerve impingement, which results in a tenderness in the muscles. You get muscle spasms and a sharp piercing pain. The best way I could describe to people about the pain that I experienced from my injury fusion was, imagine somebody driving a molten hot railroad spike into your body, going deep into the muscle tissue. That's the pain signals that you can experience once those nerves are impinged. And here you can see in this diagram a example of what that looks like. The top portion is a healthy disc. In the middle there, you've got a degenerated disc, and you can also see this bone spurs on there. And the collapsing is what causes the impingement of the nerves, because they don't no longer have the space in between the discs where those bundles exit the spinal column. Since the middle of the 1900s, fusion had been the common surgical procedure for addressing disc degeneration. Fortunately, in the early 1990s, disc replacement was first introduced, although it was not widely known. Both the fusion and the replacement uh, are performed similarly. They're both somewhat invasive under general anesthesia. Preparation is similar in both. You're on the table, they clean the neck to disinfect any microbacteria. They then make an incision, move everything aside, your esophagus, your trachea, blood vessels, muscles, move everything aside so they can access the discs in the back. Once they get access, they then remove the discs from between the vertebrae that are damaged, then grind off any of the bone spurs that are in there to get it prepared. Then, if it's for the fusion, they will take a bone graft from another part of the body. Common is pelvis or sternum. They took mine from the sternum. And then they insert the bone graft in between the vertebrae, put a metal plate on top of all that, and drive screws in through to lock it all in place. And sometimes they will put a cage around the grafts themselves to help hold it in place. As for a replacement, it's similar, except for when they get the bone spurs cleared and prepped, they don't have to take bone from another part of your body or from a donor plant or whatever it might be. They just put in that synthetic disc replacement for you. And as you can see here in this illustration, this is actually my x-ray. And I've tried to highlight, I don't know if the arrows are highlighting for you, but I tried to point out those different areas of what I just described about the cage, the bone fusing in between each of the vertebrae, and then the metal plate that's on the front. Okay, so now that we have a basic understanding of what the procedure is, I will discuss the reason I encourage you to consider a replacement over a fusion. First, the success rate. According to Dr. George Rapard, yes, Rapard, a endoscopic specialist in neurointerventional surgery at the Los Angeles Minimally Invasive Spine Institute, he declares that the success rate for a single level procedure is 52 or 55.2% for a single disc and 60.8% for two discs. On the other hand, a fusion, somewhat comparable for one disc, that's 50%. But this is where the numbers get alarming. For two disc, it drops to near half at only 34.2% success rate for two discs. And the reason that is because the immobilization of the fusion ends up causing additional stress on the adjacent vertebrae because nothing is moving as it should. Next, recovery time. For the fusion, the patient usually remains hospitalized anywhere from 2 to 4 days. In my case, I was in there for 3. Following the replacement, patients are typically released within 1 to 2 days. Now, the major difference between the two. Because, like I mentioned before, bone graft is put in there, it takes time to heal. Because it has to heal without anything moving to cause damage, you are put in a cervical collar, commonly known as an Aspen collar, 24/7 for 3 months. And here you can see a diagram of what an Aspen collar is. And that thing is adjustable, but it fits you snug. You have no motion in any direction. That 24/7 that I mentioned is truly 24/7. I was issued 2. I had one that I used for when I was in the shower. The other one was the one that I wore every other time of the day and while I was sleeping. The cervical collar completely, like I said, immobilizes you. You can't do anything. So it's unsafe to drive or do other activities without some assistance. Even eating is kind of difficult. On the other hand, a collar is not required for a replacement surgery. The other major factor, and I think is the most important, is the mobility. With the factors that I pointed out earlier about the fusion, the discs are locked in place, and so you no longer have the movement that you did normally. And this illustration shows how the vertebrae are locked in place. There's no motion either direction, front, back, up, down, side, side. Whereas with a replacement, because it's basically a replacement of the synthetic disc that goes in between your vertebrae, all that mobility is maintained. The ultimate benefit being that the adjacent discs don't incur extra strain after the fact because there's pressure put on them from them trying to move, but the stuff that's locked not moving. To give you an idea of what that means in respect to mobility, I'm going to turn sideways so you can see the example. If you were to take your head and try to turn it to get over your shoulder, in my case, that's about as far as I can go. In most cases, likely you can almost get your chin directly over your shoulder. That's not the case once they fuse those vertebrae together. And the more discs that are fused, the more limiting that rotation distance is. Luckily, again, mine was only 2. They were going to try to do 3, but I didn't like that idea. So to help encourage you, in considering all the information that I expressed about the advantages of it being a higher success rate, that there's a shorter recovery time, and that mobility is utterly maintained, I hope that my experience encourages you to consider disc replacement in the future should your degenerative discs need medical intervention. I appreciate you listening. Thank you very much. Have a good day.